Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Welcome back for our next episode of Your Aged Care Compass. We were just about to begin recording today's episode, and Coral messaged me about an article she just read about home care packages. So we've decided to discuss this article as today's episode. Coral, tell our listeners why we changed tack today and are discussing this article.
Shell, I'm always watching commentary in the media because I'm always interested to see what's being reported about our aged care sector. Predominantly, articles tend to focus on residential care. So when I see an article about home care, it grabs my attention. The article by 9 News reports on the wait times to receive an approved home care package and the lack of services available to the recipient of the package, an older lady living with her daughter in Sydney's Inner West. The daughter reported in this article that when her 91-year-old mum was approved for the package in September last year, the wait time until assignment of that package was 3 to 6 months. What we know is that over the next 6 months, the wait time blew out to be 9 to 12 months to receive that level 3 home care package. And this is what the daughter was highlighting in the article, that over that period of time, from approval to assignment, the time her mum had to wait tipped out to almost 12 months. So Barbara, the daughter, then goes on to say that even though her mum has been assigned her home care package, she's not getting any services due to the provider not having any staff to provide the services. This point really got my attention because a home care package can virtually guarantee service provision. So today I want to comment on this article and unpack what has occurred here with Barbara and her mum and address Barbara's dismay at considering changing providers because she thinks there's no point, that the next provider will probably be the same as the current provider.
Yeah, I'm so glad we're discussing this article, Coral. I must say it's timely and reflects the frustration we hear about every week. Looking at the article, the headline draws the reader in with home care lags behind high demand. But then there's a video clip of people and staff from an aged care facility before the article goes on to discuss the wait times for home care packages. I know you have a comment you want to raise here, so please tell our listeners why the video and written article bother you.
Shell, the aged care system is confusing enough as it is. People get so confused about entry-level services under the Commonwealth Home Support Program or CHISP program, and they think these fragmented entry-level services are a home care package. They get confused about being approved for a home care package, thinking that the approval documentation, which is the summarised written account of the ACAT assessment, is the assignment of their home care package. And then they get confused about in-home, centre-based or cottage respite and residential respite. And then there's confusion about keeping a home care package when a person enters residential care permanently. So 9 News, I think being considerate to people reading this article, it might have been prudent to have a video clip of someone receiving support at home instead.
Yep. So Barbara, the daughter, talks about how long it took for her mum to be assigned the home care package. Can you explain to our listeners how the wait time is decided and by whom?
When the ACAT completes their assessment, they have a pretty good idea of what level of home care package they're going to approve for the older person. It might be a level 1, 2, 3 or 4 home care package. The ACAT also determines, based on the urgency for support, if they'll approve a person as a medium priority or a high priority. What this means is where the person's approval enters the queue or the national priority system. So the wait times as described by Barbara reflect a medium priority approval for her mum's home care package. If Barbara's mum's needs changed significantly, and perhaps they did, while she was waiting for her home care package to be assigned, Barbara could have asked for a priority review, also known as a support plan review, and had her mum's priority changed from medium to high, effectively pushing her mum to the front of the queue and decreasing the wait time to be assigned that home care package by many months.
Coral, do you think people are aware of that option?
No, they're not, Shell. I see this all the time in social media support groups. You know, I see people complaining, carers, adult children. We hear it ourselves about carers being completely exhausted and having to just hang in there for another 3, 4, 5, 6 months until their older loved one gets assigned a home care package. And the older loved one may have had, you know, there may have been a significant change, a critical incident that absolutely validates that person needing to move to the front of the queue and get that priority level changed. People just don't know.
Yeah. So these increased waiting times are pushing people into crisis situations. The whole idea of in-home care is to keep people in their own homes and out of residential aged care. But because of these extended wait times, older people may decline to a point where they can't stay in their own home because they need that support to do so. Effectively, the choice is taken away from them.
You're absolutely right, Shell. As I've just mentioned, people can ask for a priority review so their loved one can move to the front of the queue, but people just don't know this. And, you know, it's not as simple as calling My Aged Care and asking for a priority review. You have to gather all your evidence to convince the aged care assessment team assessor that there's an urgent need to receive formal support. What happens when carers have to keep providing such high levels of support while waiting for their older loved one's package to be assigned is that they burn out. And then they themselves end up in hospital because stress has taken such a toll on them. Or, you know, their older loved ones end up in hospital as well because the carer is completely exhausted and can't continue to provide care.
Yeah, absolutely true. FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au. And Coral, regarding the support plan review you've just described, are there limits on how many people can be given a high priority package?
I don't have any exact figures, Shell, but aged care assessment teams that, you know, we're privileged enough to chat with from time to time suggest that the Department of Health and Aged Care encourages them to keep high priority approvals to around 10% of their total approvals. And I've heard from different ACAT assessors that they get reprimanded by the department if they are deemed to exceed the number of high priority approvals that they're supposed to be maintaining.
Wow, that's a bit of an eye-opener.
So having been a former ACAT assessor and a clinician, we're all about meeting the needs of the client, and the consumer should be sitting front and centre of the care
Yes.
that we deliver. So it's very, very difficult for ACAT assessors to go out and see people in such need, but walk away knowing that, wow, I've already done X amount of high priority approvals this week. I can see that this person really needs a high priority as well. And then having that dilemma of, Will I give them a high priority and I might get in trouble for that? Or giving them a medium priority and know that that's probably going to push that carer into some kind of crisis because they have to wait so many more months than for their older loved one to receive the home care package.
Yeah. And I noticed this article talks about the time taken to actually get an assessment, which can also be many months. So that's before a person even enters the national queue to wait for their home care package to be assigned. These times aren't mentioned in official documentation. Do you think this needs to change? Is it giving people false expectations?
It absolutely needs to change. When you add in the wait time to be assessed, then the wait time to actually receive a home care package, this time frame could add up to be 18 months or more. People just don't realise how long it takes to get through the system to get the help that they need. And the comment that I hear too frequently from older people in particular is, I don't need the help now, I'll wait until I do. And if they do that, it will be too late. Their options will be very limited.
Yep. I think we also need to highlight that in Barbara and her mother's case, Barbara is providing care and assistance to her mother, as well as paying privately for support services. This will be taking both an emotional and a financial toll on Barbara. And in the case where older people don't have a loved one to help them, they may have to pay for their own support services privately. And again, this is not necessarily sustainable. These increasing wait times are placing a lot of burden on a lot of people, not just the older person themselves.
This is right, Shell. Family members are dipping into their own pockets to source private care for older loved ones, and they're giving up work to stay home and care for older loved ones because there is no other option for them.
Coral, do you think the workforce problems that the aged care industry has are contributing to the lack of support that older people are able to access? As Barbara highlighted in the article, the provider not having any support workers or carers to meet Barbara's mum's needs.
It's true, Shell. The workforce across the sector is an issue, but believing one provider is just like the next is misinformed. When you're assigned a home care package, you have 56 days to choose a provider and enter into a service agreement with your chosen provider. During these 56 days, and preferably even before this time frame, you should be doing your research. Choosing a provider for a home care package is a very considered decision. You need to ask around in your local community and see what other people are saying about their providers. You need to research and shortlist providers who appear to be attractive and then call them to discuss the older person's needs. And you can even ask other people in the many social media support groups about providers as well.
Yep.
But one provider is not like the next. There are many good providers who have loyal staff and can provide services. If a person like Barbara is not satisfied with the service provision of their provider, they really should think about moving to another provider.
Okay. Coral, a real sticking point for me is the statement from the spokesperson from the Department of Health and Aged Care, where they said there are other options available to older Australians who are waiting for their home care package. And the statement was, they may access aged care services through Commonwealth Home Support Program, state or privately funded services. I wonder if this spokesperson actually has any idea of how much private services cost. And you're asking aged pensioners to pay for this. I saw a provider yesterday advertising a starting price of $82 per hour plus travel costs with a minimum 2-hour placement. That's for basic domestic support, nothing else. I also wonder if this spokesperson has any idea of how oversubscribed the Commonwealth Home Support Program is.
I feel pretty confident in saying that the department representative has no idea how much private services cost, how challenging it is in some areas to get any CHISP services, and state-funded older person services are likely to be very short-term and not funded at the level of the higher home care packages.
So in a perfect world, how do you think this situation could be improved?
Well, I think the department needs to allocate more funding to the home care package program, but I don't think the department will agree with me.
I hope you've found our commentary on the 9 News article enlightening, listeners, particularly if you've read the article. Understanding how the aged care system works does place you in a stronger position to advocate for yourself or older loved one, and it does help to get the in-home support you or your loved one needs in a timely manner, should that be your situation. We have the link to the 9 News article included in the show notes, as well as a couple of our blogs that explain how to get aged care in-home support. Thanks for joining us today. We'll chat with you again next Tuesday. Hey Care community, thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.